Next, we're going to cover two muscles in this video for trigger point therapy. The first muscle will be the Latissimus dorsi. The Latissimus dorsi is a large fanning muscle that covers a large portion of the back. So go ahead and come over here, Hillary, just so I can kind of point to where it starts from. So it comes down here and originates off your thoracodorsal fascia, and then also from some of these spinous processes here on the spine, so in the lumbar spine, I think even some in the thoracic spine as well. And it also originates off of the ilium here. And it's going to wrap along the front and inside part of this muscle, and it's not going to wrap here along the back side of the shoulder, but instead wrap along the inside of the shoulder. And it's going to insert onto the intertubercular sulcus of the humerus. And next, we also have the teres major. The teres major is, it originates off the posterior, inferior, and lateral aspects of the scapula, and it inserts onto the intertubercular sulcus of the humerus, which is the same spot that the lat works on, or that the lat inserts on. So we're going to work on these muscles in a very similar fashion. It'll just be slightly different between the two. Both muscles are primary extensors of the shoulders, internal rotator of the shoulder, as well as adductors of the shoulder, so bringing your arm tight into your side. So Kristen, I'm going to go ahead and have you raise the roof for me. When she's raising the roof, she's placing this muscle on stretch. In order to further exacerbate the stretch, she's going to reach up and overhead. This will specifically stretch the lat as it fans all the way across this area. So go ahead and run back and forth between that where you're down here by your side. And then you're going to raise the roof and reach up over top of your head. And as she would be here, I would be working on the front side of the armpit here. I'm working all the way down into the inferior border of the scapula here. And this is where I'm going to find trigger points. So go ahead and do that for me, Kristen. And I'm giving her a little bit of scapular assistance, if you can capture this as well, Hillary, where I'm pushing and rotating her scapula up for her as she goes in between these different positions here. And I'm stripping down the length of the lat. I'm using 2 or 3 fingers, just like so. And if I wanted to do a different technique, I can also do a pinch grip with these 3 fingers and my thumb as she reaches up and overhead and leans towards the side. Just working along the length of the lat, just like so. And then I can even do a little bit of extra work on the teres if I specifically tell her, instead of being in this position here, to be further out to the side, and she's going to reach directly up. Now, the teres has no function in lateral bending of the spine like the lat does, so she can go ahead and just reach up with no bending of her spine. And she is a little bit tighter here. And I can also do that scapular assistance here. Keep that elbow nice out to the side, Kristen, perfect. Reaching up and over. And this one, I tend to prefer a pinch grip here as well. As another intensity technique, since this is, I think, probably the second most intense trigger point besides the anterior deltoid of the shoulder, is as Kristen's reaching up there, I can do a cross friction technique. So I typically take 3 fingers just like this, push from the front and the back. Go ahead and reach up, Kristen. And then I will tell them to hang out in this top position here, and I can strip and rip just like this. Obviously like a little bit slower and a little bit more deep, but just to kind of break up any scar tissue or adhesions that they have at that part of the shoulder.